Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And in this case, we're talking about church health. We are joined by their Clinical Administration Director, Andreana Smith. And how are you doing?
I'm doing great, and I'm excited to be here, Jeremy. Thanks for having us.
Absolutely. Well, you all do tremendous good, a long legacy when you look at church health. Let's start with some history. So give us a little bit of history for church health.
Sure. So we were founded in 1987 by our founder and CEO, Dr. Scott Morris. He came to Memphis from Atlanta wanting to serve the underserved in our area. So he is a Methodist minister as well as a medical doctor. And so even now you can find him in our walk-in clinic serving patients. And as you all can see behind me, I'm at the lovely Crosstown Concourse building. We moved here about 6 years ago, and all of our clinics are under one roof. We're able to make the biggest impact by seeing the most people and make it as easy as possible for us, for our patients to get to our different clinics.
Absolutely. And you all do a lot. And so when you talk about the primary health care, pediatrics, working with the youth, you also do dental and eye care. And so there's a lot. Rehab, I mean, it's like it goes in nutrition too. So how do you paint the picture of everything you all do?
Well, we paint the picture of saying we take care of the whole person. So we try to offer any service that someone might need. Our main demographic is folks who do not have health insurance. So just thinking about how to navigate a system, if you do have health insurance, it can be extremely difficult to understand. So we try to reduce as many barriers as possible for folks to come into our system and not have to worry about how do I get to this specialist and what do I do here? So most people come to us by way of our medical clinic because they're feeling sick or hurt. We have a walk-in clinic for those purposes, so you don't have to be an established patient to first come into our clinic. Most people want to establish themselves somewhere and have a medical home, so we can do that as well. During the appointment, you can have a behavioral health coach, a dietitian. Maybe you are dealing with some depression issues. So we'll have someone come in who can do some counseling with you. We try to offer all of that in that one visit. So folks don't have to take off work again, miss work, miss pay, and have that just all in one visit. So they're able to, we're able to maximize the time that we have them here and take care of as many needs as possible. So we have a dental clinic that's in this building. We have an optometry clinic. We partner with the Southern College of Optometry, and we're in the same space as Focal Point here at Crosstown, as well as we have a physical therapy clinic. We have the YMCA, the Church Health YMCA that's in our space that folks can utilize. And one thing we offer, a lot of folks don't know, is that if you're a patient with church health, and I wish my doctor's office did this, but they don't, but we offer childcare. So while you're here during that appointment, if you're having trouble finding childcare, don't want to pay for a babysitter, we will watch your children for you during your appointment for free. So a parent does not have to worry about paying a babysitter, having somewhere for their child to go during that appointment. And then, like you said, we have a nutrition kitchen, so you can cook. We have a chapel where we do meditation services, a lot of things, but really taking care of the whole person and your whole health.
I love the focus on partnerships and what you're talking about, like with the YMCA and the different organizations. And really, obviously, the space being at Crosstown Concourse allows for some powerful collaboration. But I love just the extent you go to bring everyone to work together and think of everything like you're talking about with the childcare. I think those are very important pieces of the puzzle to ultimately lead to success. Talk about on your end, the individuals you serve, because I think, painting the picture of what these families and individuals are dealing with will then kind of lead me to the next question, but give us an illustration of those who you're working with.
Absolutely. So mainly our patient population are folks who are working and uninsured. So if you think about people sometimes in the hardest professions out there, like landscaping or being a nanny or housekeeping services, they aren't always offered healthcare. because they might be working for a private home or own their own business, doing these tasks. So a lot of times those are our patients. So anyone coming to us, like I said, they do need to be working, and we mainly serve uninsured people. We do have some folks on Medicaid and Medicare and commercial plans, but those were previously our patients, and we want to be able to keep them with us. So if you're working in a profession that, let's say that you are a housekeeper in a private home and you need to go to the doctor, well, while you're coming to the doctor, you're potentially not cleaning homes, you're not working during that time. So we are trying to help you with your childcare needs. And like I said, maximizing that appointment while the person is here, so that if they do need to see someone to help them with their diabetes, if they need to see someone outside of the appointment for an x-ray, we can offer that x-ray here. If they need to see someone to maybe help them with some mental health issues they're dealing with, or talk to them about their depression, they can do that generally during that appointment time, instead of having to make another trip, take off work again to come, find childcare during the summer months for their children. We can offer childcare here for them. So we try to, like I said, decrease as many barriers that someone might have in going to the doctor. If you're like me, Jeremy, you sit in the waiting room sometimes. Fortunately, we probably both have positions that even while we're not at work, we're still getting paid, or we're able to take hours off of work. But not everyone is in that situation. Time is money for a lot of people, and if they're not working, their family might not eat. So we want to make sure that we're giving people quality care, but just taking care of them and their family during that appointment.
Absolutely. We're going to talk about the MEMPHIS Plan next, which ties to this, but I want to kind of tie one more piece in this, in the sense that the statement it makes, because when you do a tour and you see firsthand the beautiful facilities, the extent you go to with like the dental clinic and the top equipment, the latest and greatest, when you look at the state-of-the-art side of the equipment and the beautiful facility, I think it makes a statement that those coming in for the services, for the help, are getting world-class treatment. And I think in many cases, sometimes you think, oh, it's something that they might not be able to experience that's the world-class side, but yet you're providing the world-class experience. So in other words, what does it mean for you to have the facility, the state-of-the-art equipment? What sort of statement does it make for those individuals and families who you're serving to be able to say, hey, you're loved, you're appreciated, and we're going to take care of you?
I love that you said it in that way. I think one of the things that a lot of times folks who are experiencing are on the cash economy, or folks who might not have insurance and who are using charitable clinics or places that might be deemed for under-resourced people, they don't always look like a doctor's office or facility of people who have insurance. And one thing that I absolutely loved when I was interviewing to work at Church Health is that I came into a space that was clean, it was beautiful, and we offer care that we want our mother or a family member to have. So when folks walk into our facility, we want them to know, like, hey, you are important. It does not matter what your profession is, what your job is. I mean, we are all God's children, and we are special in His sight. So you're special to us. So the quality of care is directly related to just you're important. So people waiting in line, people having to experience some difficulties that they might going to certain places that they need social services. We do not want. We want to eliminate that. We want them to walk in, like you said, into our dental clinic, which by far is, like you said, it is unbelievable. It's 24 chairs. We work with Delta Dental. They have donated all of this high-tech equipment. We have people, I go to my dental office and they're, doing the x-ray all over my mouth. You come to our dental clinic and they have an x-ray that just goes around your head and you're done. I'm like, I don't have that. But it just speaks volumes, I think, to hopefully our patients, that they know, like you said, they're well loved, that they're cherished, that we want to make sure they get the best and the most qualified care. I just, yeah, that's one that I'm so happy that you brought that up. But yes, that is extremely important to all of us here at Church Health.
Absolutely. I love that myself personally. So let's talk about this MEMPHIS plan. So it's a very important opportunity for small businesses, especially, but talk about the MEMPHIS plan.
Absolutely. So one of my roles here is the director of the MEMPHIS Plan, and it is near and dear to my heart. I think that it is one of the best kept secrets in Memphis, besides our clinic here at Church Health. But small business owners so many times want to be able to offer healthcare to their employees. They know them well. They know their families. They know everything about their children. They're working alongside of them with their employees. And many times, if they go to get a commercial plan, they're priced out. It's just so expensive to be able to offer something that's affordable for your employees, for yourself, and still run your business and have a level of profit coming in. So the MEMPHIS Plan is geared towards those small business owners in our area. Right now, we have over 3,000 lives that we take care of. And business owners can come to us, they can sign up, their employees sign up themselves. It's $50 a month. Their employee will get access to their own doctor. And those doctors aren't just at Church Health, they could be near where the person lives or works. So we have doctors in Atoka, in Germantown, Cordova, Collierville, even some in South Haven. So just making sure that the person can go to a doctor close to where they work or live, just to make it as convenient as possible for them. It's $5 when they go to the doctor. There's no deductible, which is unheard of. And that's for all of their visits. They have access to all of our specialists in our system, as well as hospitals. So if they have an emergency that happens over the weekend and they can't get into their doctor's office, they can go to the emergency room. Whatever happens during that visit is taken care of, all under $5, no other charges for that patient. So it really is an amazing deal. And we would love to talk to more people about it. They can, access our website at churchhealth.org or memphisplan.org. Give us a call. But yes, it is truly one of the best kept secrets, I think, in Memphis.
Absolutely. And it's made possible, back to the idea of the partnerships, is made possible because of your partnerships, your relationships, and your very unique model that allows for this sort of opportunity. And so I know it's hard to kind of share the model and the power of the partnerships in a short soundbite, but give us a little bit of a teaser on really how all this magic works that makes this MEMPHIS Plan possible.
Yeah, how does it work? How does it work? One of the things about Memphis, if you've been here for half a second or been here all your life, you will know that we have a very caring medical community. I mean, St. Jude, we're the home of St. Jude, but we partner with Methodist and Baptist. Those are our two hospital partnerships, as well as some clinics in our area. Christ Community is a large one. The Methodist groups, Baptist groups, I'm going to leave some important people out. But with a lot of the clinics, most clinics in our area and a lot of our private doctors, they have come together and said, hey, we want to make sure that we're taking care of the most vulnerable in our community. We got into medicine because we want to take care of people and we love people. The magic of Dr. Morris coming in and encouraging this group of people and these doctors and this medical community to then say, we will take care of this group of people and we will write off all of the expenses that come along with it. Because they understand, you understand, your community understands, a community of listeners, that when people are healthy in your community, it actually drives the cost down for medical coverage. People going to the emergency room as their medical care is not good for any of us, with insurance or without insurance, because someone pays for that ultimately. So our hospital community understood that. And so they said, look, we will make sure that folks have proper access to a primary care physician. And when you have that and you're able to control your heart disease or your diabetes, things like that, you go there first rather than going to the emergency room when it's out of control. And it costs more for everyone, especially for folks who probably are not able to carry the cost. I mean, out of pocket for the emergency room is astronomical for anyone. So that is the magic of it all. It's written off. It's a network of volunteer physicians, specialists, hospitals, and labs. And somehow it works really well, and we're able to take care of 3,000 people a year.
Absolutely. And I think it's a powerful story for Memphis, of Memphis, exactly
Yes.
like you're talking about, and something that this model that Church Health has created is now something that other communities across the world are trying to replicate. So I think it's a neat story for Memphis that I think more people need to understand and also appreciate. So wrap up with your website. You mentioned a little bit before, but mention it again. So website, where do we go to learn more, to dive into the MEMPHIS plan deeper? So where do we go to learn more and also start taking the next steps to get involved?
Sure. Yes. If you want to learn more about Church Health, the work that we do here, become a donor, or maybe send somebody who you know who does not have healthcare right now, they can become an established patient. Just go to churchhealth.org. But if you're a business owner, maybe you have someone working privately in your home as a nanny, housekeeper, or you're just starting out as an entrepreneur in your new business, as an artist, musician, we welcome you to join our MEMPHIS plan, and that is memphisplan.org, or you can call us at 901-272-PLAN.
Well, greatly appreciate everything you and your amazing team are doing with Church Health. Thank you so much for coming on the show.
Jeremy, thank you so much for inviting us. It's always a pleasure to talk to you.